about that. The way that we did it in this analysis is we just controlled for non-binary versus binary identity, and there were some significant differences, but not a lot. But I'm actually wondering if maybe we should stratify and look separately at like AMAB binary versus AMAB non-binary and see how risk factors may work differently. So then the tables will be even larger. But yeah, and Ames, you had a question?
Are you aware of any research that is looking at whether criminalized identities are also used as a power and control tactic in trans intimate partner violence, like criminalized HIV or sex work or needle use?
Yeah, so I haven't seen as much around drug use, but I know there's a lot of work from like domestic violence coalitions and practitioners around HIV status and a stigma against people living with HIV as being used as a tool of power and control. So I've seen like power and control wheels that like take that into account, especially. Yeah, so sure. Any other questions? Thank you so much.
Hi, everyone. Thank you for coming. Please be seated. We're probably going to start within like the next 2 to 3 minutes. Thank you.
No, we don't. Okay, I wanted to make sure. I'm like, it said yes, and then no, and then yes. Yeah. So, okay, perfect. All right, thanks. Well, we're gonna put 2 aisle mics for the any portion of Q&A or anything like that. So.
Thank you. Thank you. London, 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 London. There's a plug right up here. Oh, it's a live stream.
Check, check. 1, 2.
So who forgot to tell us?
You want to mute those?
Hello, everyone. Hi, everyone. If you can hear me, clap once. If you can hear me, clap twice. Great, thank you. Thank you. Nice to meet you all. My name's Dorcas. Pronouns are they, them, theirs. Before we jump into it, I just want to acknowledge we are on stolen land, land that belonged to the Anacostans and the Natchatang tribe. I'm sorry if I mispronounced that. Before we jump in, I also would like to hold a brief moment of silence for Black trans feminine people and Black trans women that were slain in the area as of late. I'm going to read their names. We have Ashanti Carmen, Zoe Spears, and Bailey Reeves, and the names of the many that we may never know. So please, can we have a moment of silence to honor them? Thank you. Before we jump in, I'm just going to give a brief history of USPATH. This is the second gathering in the United States that I recently learned that. And this is the first time the USPATH conference is happening with we currently have a USPATH board that is about 50% trans and gender nonconforming, so clap it up for that. We also have our inaugural or very first class of community reporters or reporters, and which is what I am a part of. So my name is Dorcas. My pronouns are they, them, theirs. I currently work for an organization called Transforming that provides holistic care and services to trans folks assigned female at birth in the South. We are also currently fundraising to get a new transforming house to house people coming out of jail and ICE detention, so please visit us and give at trans-forming.org. Thank you very much. And I'm also going to open the floor to the other community reporters and reporters to introduce themselves.
Hi, my name is Gaines Blaisdell. I use he, him, and his pronouns, and I'm one of the community rapporteurs. Thank you.
And I'm Nova Bradford. I am joining you from Minnesota. I use she, her, hers. I'm a graduate student in the University of Minnesota School of Social Work, and I am a research assistant in the National Center for Gender Spectrum Health. So thanks for having me here.
I am London Smith de Richelieu. I work at the Johns Hopkins University School of Public Health, and I am with a program called CLEAR, which is a project of Be Sure. It's communities leveraging evidence for action and resources. Thank you.
Shout out to the team, the squad. And also please forgive me, I didn't even mention where I'm located. I live in New York City, and I'm also currently a graduate student at Columbia University studying health policy and management. Well, thank you. So basically, this town hall was called to action, I guess, in response to past community rifts between the trans community and the USPATH conference. The board and new leadership has expressed desire to be really intentional about bridging that gap and trying to heal the relationship between the trans community and the conference. So that's why we are here. And I also just want to lay the ground rules. So we have some questions that were submitted via registration, as some of you may know. We're going to get to those a little first, and then we will open up the floor. But I also want to emphasize this is a conversation between trans community members, and we love our allies, but part of being an ally is knowing when to step up and when to move up and move back. And for this particular conversation, we are asking for cis folks, cisgender folks, or non-trans folks to please open up the floor to trans folks, and try and sit back. with that being said, I'm going to pass the mic over to London, who will address a few questions that were left in the registration. So thank you.
First, I would like to announce that I sit on the planning committee for the Maryland Trans Resilience Conference, which will be on September the 21st in Baltimore, Maryland. It is the first trans-led, trans-focused conference in Maryland. And thank you all. We have an event page. We also have a website. We have an event page, which is on Facebook, which is Maryland Trans Resilience Conference. And if you go on the event page, you can go ahead and click the Eventbrite, which could take you to sponsorships as well as tickets. I urge everyone to come out and participate and help us with our inaugural event. So, my first question, how to address the issue of cisgender leadership in transgender health organizations? How do we support and encourage cisgender leaders to support, mentor, and give space to trans and non-binary leaders to take over trans health orgs?
We would like to invite a member of the USPATH board to answer this question, either Asa or Maddie. And we could pass the mic down to you.
Hello. Okay. No pressure. I'm Maddie. I'm the president-elect of the USPATH board, and Erica Anderson, who's the president-elect, who like 2 days from now will become the president, and I'll just become the regular president-elect. We're both trans. The board is about 50% trans. That happened by no affirmative action. That just was kind of the cookie crumbled that way through an open election. And, that's really great news. Some of my best friends are cis people. I enjoy collaborating with people cis and trans. The USPATH board opinion would be that there would never be a future where there would not be cis people involved in this field, including in leadership roles. But that the direction that things are moving, where there's kind of an increased percentage of trans people in leadership, and cis people in leadership positions need to be able to exercise their leadership roles, but also thinking about things like power and privilege, unconscious bias that may exist in the carrying out of their duties. So that would be my thought. Anybody else want to say?
We would like to ask everyone to come on into the room, welcome you into the room. Come on, this is a safe space. Come on into the room. Thank you. There are seats. Get to know someone, sit next to someone, say hello, exchange names. Next question. Are there any plans for dealing with making USPATH more accessible, especially financially, to trans community?
Erica Anderson, and I will be taking over as president. Pop goes the weasel. Okay, my name is Erica Anderson. I become president Sunday, and as Maddie said, we were elected by membership in an open, voluntary election, all of us. We have lots of ambitions, those of us on the board, especially those of us who are trans-identified on the board, and one of them is to bridge the gap, as Maddie says, between the trans community, the lay community, as well as the trans-identified professional community. I got the short straw because the question she answered is one that we've batted around a lot, and I think have good consensus on. This one, not so much. The issue was that we needed to find a hotel in a city that was accessible and potentially could accommodate 1,000 people. We had to do it under time pressure, and we had the advantage of having some staff from USPATH to help us. You may not know that we got a good deal on this hotel, better deal than most people would get at other hotels in DC. This was actually cheaper than the other cities that we looked at for what we needed to do. And the costs are comparable to other professional and scientific conferences. We made some compromises. This is a scientific and professional association, but we are trying to reach out very obviously, I think, to the trans community. And we are aware that the cost of attending a meeting like this is high, okay, but it's no higher and arguably not as high as some. So, you know, we made some efforts to bring people in, all the programs that you're now aware of, this very meeting, the repeteurs, the reaching out to DC and Mid-Atlantic area activist organizations were a part of our effort. And if I may, I believe this is the first such meeting at any USPATH event, a town hall, including trans-identified people. No, not true. Okay, sorry. But nix that, since I don't have the history, because I was in the closet. So there is that. But but we did the best we could. And I think we're going to try to learn from this experience and try to figure out ways to bridge the gap again with the trans community in the ways that we can. I believe we are, now I'm going to go on limb again, I believe we are live streaming. We are live streaming this. We sent the invitation far and wide. We probably have a couple hundred people who are watching us now, wherever they are. And that was another, thank you. Another, I guess, point we were trying to make is we don't have anything to hide. We're trying to be transparent. We're committed to open and fair elections. We're committed to a meritocracy. The people who can should do it, no matter what their background, and so on. And that includes cis and trans both. I don't want to create a gulf between cis and trans. Like Maddie, I have lots of cisgendered friends and colleagues, and we work together to support the effort to create the best science and the best practice for trans health. That's probably enough.
You can do it now. Yeah, do it now.
Oh, thank you. Hold on, hold it. Let me turn my phone back on. I apologize, you all.
Thank you. So I think that this is really, really cool. So first and foremost, to you all, thank you all so very much for being here and being in front of me. One of the most important parts for me was to see someone who looked like me. So I really appreciate that, with no pun intended. I think that one of the most beautiful things that happened for me today was the fact that we did stop and we did have a moment to honor some of the people that were murdered. I don't know how many people are in this room that may be at the age of 17, but one of the most recent murders, the young lady was 17 years old. We went and stood in front of the White House last night to say her name and say their name, and also to say that Black trans lives matters and trans lives matter. Well, thank y'all. So the thing for me is that my questions become, my name is Dee Dee Waters, my pronouns are she, her, and hers, and I serve as Madam Chair of Black Trans Women, Inc. We have an annual conference that we do, which is the Black Trans Advocacy Coalition, and conference that we do every year in Dallas. So whenever I'm hearing this, I just have a couple of questions really quickly. I really want to know, what does it mean whenever we say about 50%? Because when you say about 50%, that means that you have not reached 50%. So I'm just asking that question to pose it. And like, what is the goal there? Is the goal to have about 50-50? Or is the goal to be, I'm only asking because it seems like you all are going in the right direction. And I'm just trying to figure out, like, what would that goal be? And then the second part would be, within that, how do we as people, as individuals, step up to the plate to be able to be a part of that, if that makes any sense, as trans folks? I will be transparent. A lot of times, a lot of trans folks don't really always, are not available to step up to the plate a lot of times, but sometimes it's only because we don't know what we need to do so. And then lastly, I know that there was something brought up about staff. My question with staff is staff paid? And if staff is paid, because again, I'm with the organization and we have staff, and our staff is not paid. It's a Black trans organization. But is staff paid, and is staff also about 50% of trans people? Because it's great to be on the board, but it's also an amazing thing to get a coin. So that's the reason, those are my questions. I apologize.
Would a member of the board like to please respond?
Please rank order the difficulty of these questions, would you? Okay, so 5 out of 8 of us, 9 of us, are trans-identified. Can you count? That's a majority. Okay. Okay. So not that it's going to be voting blocks. It's not Brexit, whatever. But we're committed. I got into this because I'm trans-identified, and I was subjected to discrimination in housing, healthcare, employment, and public accommodations. I'll bet you do. And the trauma that we feel, that we share, is important. Those of us who've had it, bring it to the work. So we're not perfect. We've just started, okay? So I'm going to editorialize for a moment. The USPATH meeting in Los Angeles raised the cry, I think, about the pain and the collective experience of trans people. The board that's here had not yet been elected at that meeting, okay? So I guess I want to say, give us a chance. We're just getting going, okay?
I think you said it. Yeah. Let's just.
Staff. What do you think? We don't have it. Yeah. Okay. Staff. So we are beneficiaries of WPATH staff. okay? And we appreciate it. They're in Chicago, mostly, I think.
Yeah, maybe Jameson can speak to the staff. I just want to make one comment about the staff. The staff are, USPATH, we're a child organization of WPATH, so we have some linkage. We have some autonomy, but we also report up to WPATH. The staff is managed by WPATH. The staff of the WPATH there's a kind of an arrangement, and it's a fantastic group of people that are contracted to do the day-to-day management of the business operations. And I just want to, they've done a phenomenal job here. But Jameson, do you want to give some history about?
So hi, my name is Jameson Green. I'm a trans man from California. I led FTM International from 1991 to 1999. And thank you. And I found out about an organization called the Harry Benjamin International Gender Dysphoria Association in the no laughing, I didn't name it, but no laughing. I was engaged in political advocacy in San Francisco, and essentially got them to have a non-discrimination ordinance in the city of San Francisco in 1994 that went into effect in 1995, and then I started working on them to open up insurance coverage for city and county employees who were trans to be able to have the exclusions removed so that they could have access to health care. And then I took the data from that and made it through the Corporate Equality Index at the Human Rights Campaign to force corporations to remove insurance exclusions from their policies, and that was one of the factors that led to the fact that Medicare and Medicaid removed exclusions in transgender coverage in 2014. So I've been engaged in this work for a long, long time. But in the 1990s, like 1997, before that, I realized that we needed more help from the medical professions. Those of us who actually engage in a medical transition needed more support in our lives from healthcare providers. And I started giving the message that we exist outside of your offices. We don't just show up in your office and have a nice time with you and then leave and everything's fine. We have problems and we need help. And so, but how to actually manifest that into something productive, I wasn't sure. So in 1997, I went to the HBIGDA, Harry Benjamin International Gender Dysphoria meeting in Vancouver, BC, and was encouraged after giving a presentation to join the association, but I wasn't allowed to join as a full member and vote because I was not a professional. So I joined as a supporting member, which cost the same as a voting member, even though I told them, well, that's ridiculous. Why should I pay the same amount and not be able to vote? But okay, I'll join because I want to engage with you. And so from that point, a few years later, I suddenly, out of the blue, was notified that I could now be a voting member. And I found out that there was a lot of debate on the board of directors for that 4-year period, 1998 to 2002, whether or not I could be admitted to be a voting member. In 2003, I was nominated to serve on the board of directors, and I was elected, and I served for one 4-year term, and then I was re-elected, another 4-year term. And I started, at that point, writing policy statements that would help trans people. Like the first one was the statement about medical necessity. And that was actually a very important statement for a lot of legal cases that were being pushed through at the time. I will. I will. I'm going through the history. Thank you. So I will get to the staff question. So basically, essentially, then I was asked to do more and more statements because WPATH was, or we changed the name to WPATH in 2007, I think. And then they started being more active. And they also elected in 2007 their first transgender president, who was a law professor from the United Kingdom, and a good friend of mine, also a trans man. And then you're making me discombobulated. Just a second. I know what I'm going to say. So I was elected president in 2011. And I knew that we needed to break the U.S. away from the rest of the world because the rest of the world is not interested in U.S. health policy. And we have so many horrific problems here in the U.S., and most of our members are in the U.S. So by chaptering, we were able to focus, we were able to now have a focus in the U.S. that more closely can address the problems that trans people face here. And we can, and the WPATH board can look at more international, global kinds of things, which needs to be done as well to increase capacity around the world. Okay, so also one of the things I knew that we needed to do, and when I was president, we hired a staff, an organization basically that runs, they're a for-profit organization that runs small medical associations, and that's what they do. They run about 22 different small medical associations. WPATH is just a small part of their business, and they are completely dedicated to our cause. They are, in their hearts, they love us and they want us to be successful, and because of their participation in our efforts, we have been able to grow, we have been able to expand membership, we have been able to have conferences like this, which we just simply could never do before. And we've started to do education, professional education. All of this happened during my presidency. And so it's been a really, really hard road to get to where we are. And I'm done now.
Okay, for the sake of time. Okay. The next question is, are there any plans to implement guiding standards for presenters at PATH conferences or hold them accountable when they overstep their boundaries?
Yeah, so we have a number of things that we've implemented at this conference, actually, to address that. That concern has been raised previously with regards to just anecdotes of people coming out of sessions and feeling upset because something was said, there's inappropriate terminology used, or photographs were shown without clear demonstration of consent of the person. And so one of our primary reasons for having this rapporteur program, which maybe I can just explain to you very briefly what that is to provide community eyes in the sessions. So what the rapporteur program is we have one other rapporteur, Lotus Dow, who wasn't able to be here for this event, but he's been present at the entire event. You'll see these folks around attending sessions, taking notes, and the intention is to prepare a lay community-oriented report that will report back on the proceedings of this conference. And we've made this program like we've publicized it. So ideally, people presenting should be aware that there's a structured and formal community kind of accountability and monitoring program in place here that is sanctioned by the USPATH board to do that. And so in addition to that, we have a set of guidelines that were distributed to people at the time of the call for submissions that had guidelines about the content, about terminology. At the end of the day, people make their slides, they say things, we can't have like a monitor in every room kind of like interrupting, but what we can do is keep kind of moving towards kind of providing guidance to the community of providers and researchers who are giving these presentations, and we, ideally will continue to have these kinds of rapporteur and other accountability programs.
Thank you. I'm going to ask one last question, and then I'm going to open up the floor. Okay? So my final question is, how does USPATH plan to hold space for non-binary, genderqueer, and gender nonconforming people?
So all of us on the board, I feel confident in this. There are many things I don't feel confident about, but this I feel confident about. Subscribe to the spectrum of gender and are clearly accepting individual differences and a wide range of sexual and gender minorities. So I think we've already seen some research presentations which have recognized the differences between transmasculine, transfeminine, and non-binary, even gender fluid folks. And this is something that we all deal with in our science and in our professional practices, and we're certainly committed to accepting, including, and supporting all identities.
And with that, the floor is opened up. If anybody has questions, feel free to approach the mic.
Is there a mic in the? Oh, let me. Oh, there.
So I'm not going to do an intro again. I'm probably going to do an exit. So what I want to say is that I pose my questions just to ask a question. Whenever you do a town hall is for the people that you're calling to come and have the conversation with to be able to ask questions. Upon me asking my question, I felt like the responses were not like the responses that I wish that I would have heard, which would have been very simple to just say we're going in that direction. That's really all that it is, and that's how I feel. I felt like to say that, 5 out of 8 or 5 out of 9 are trans people, that's more than 50%. So to say about 50%, it's misleading. Like, you all are doing this, and it's going in the right direction. So it's just the words that were being used that what made it confusing for me. So I'm on the outside, and I'm trying to look in. And I probably will never be at a conference like this again because of the cost, right? So at the end of the day, the only thing that I was asking whenever it pertained to staff was not to get, I appreciate history, I really, really do. But I want to know about what the present looks like and what the future is supposed to look like. And within that, if we're going in the right direction, which it's what it seems like you all are doing, if we're going in the right direction, the simple response to staff would have been, hey, we're working on that, or hey, we want to start trying to figure that out. What are some of your thoughts? What are your suggestions on that? Like, that's the only thing that I really would have hoped for. My concern is now that I'm going to be looked at differently, right? I'm going to be handled differently, and it's not something that I will allow, but I believe that that's how that's going to start to come off. And I didn't want that. I just simply wanted to pose the question because I think that it was a decent question, especially while I was here, and to meet people and to see folk, I didn't see what it was that I thought that I would have seen. I can guarantee you that if I look around this room, I'm not going to see as many black and brown people that we would want in this space, because from what I'm getting from you all is that's what y'all want to an extent. Like, y'all want to create the space. So I'm just saying, that's it. Thank you.
Are you leaving? Can I respond to what you said, or is that all right? The first thing I want to say is I am so happy that you just said what you said. And I'm so happy that you felt comfortable sharing how you feel in front of this room, which I think is probably something that can be very intimidating to do. I so respect that you said that. I'm so glad that you shared that with me, and that's something that I and the other board members are going to take and sit with and think about how we can do better the next time and respond, thinking about our own privilege and where we stand. And I think I can speak for the entire board that, like, our door and our ears are always open. And it doesn't matter what you have to say. If it's a feeling that you have, then it should be shared. And then there can be connected communication to kind of figure out how to negotiate that and get everybody's needs met. As far as, like, how do we get this room to basically not be a bunch of white people doing this work, right? I mean, like there's, how do we do that? And, I don't know that we as the board have a solution to fix institutional racism that starts in neighborhoods and with education disparities and all kinds of other disparities and things that result in the fact that there is a lack of people of color sitting in this room in seats as professionals. We have to do our part to try to address those disparities and do everything we can. Things that could come to mind that we should look at, mentorship programs, ways to kind of do outreach and engage. We're trying to start that process by, this is a first step. We're trying to move into that direction. We've got, a number of people who are kind of coming up through the system, and we hope to kind of elevate and center those voices. So we see the problem. I don't know that we have an easy fix to the problem. We are very aware of it. It is very much in the front and center of our radar. So you are heard, and what you have said is important and meaningful, and I appreciate it. And I want to encourage others to take the same initiative to make these kinds of comments, including if they're wrapped in tones of frustration, even anger. We understand where they're coming from, and we want people to be able to express themselves. So thank you very much.
I don't like public speaking, so bear with me as my voice quakes. I'm similarly not satisfied with the answer we heard to the question about reducing the financial burden for transgender researchers to participate at this conference. It's the same blanket excuse of an answer we received to the letter that was submitted, I believe, last summer about the cost in that, yes, this conference is comparable to the cost of other academic conferences. What's different is this conference and USPATH and WPATH as a whole have created a space where cisgender people can build their careers and their money on our experiences. So what I was hoping to hear was not the same excuse, but what you're going to do next year. Are you going to create scholarships for trans researchers? Are you going to create an opportunity for us to work the conference in order to present our research that is built on our lived experiences, that is trying to upbring us? What are you going to do?
Thank you for sharing that. It's a big problem. We were all just kind of conferring here. We don't have like an immediate solution to the problem. We're aware of it. I mean, finding funding to allow those kinds of things to happen. I mean, so the WPATH has the Rose Fund, which is a start, and there's an opportunity for people to make donations to that fund that is designed to provide this kind of support at the WPATH level. It's something that we need to go back to as a group, as the board, and take that feedback and find a way to respond to it constructively that we probably can't respond to this evening. But the comments are heard and noted as important. And something that we discussed as a board the other night when we were preparing for how we were going to respond to these things is we knew that we would not be able to give you answers to all of your questions, and we knew that some of our answers would be unsatisfactory. And we don't know that we'll be able to solve all of the problems, but we will get back to you with some kind of a more definitive answer once we put our heads together. And so our promise to you is that you will get a more meaningful response after we've had an opportunity to kind of put our brains together. And you can hold us accountable to that. I mean, this is being live streamed, it's being recorded, there are minutes being taken somewhere. So if we don't get back to you on that, then we've failed.
Most people are shorter than me. You should lower this. My name is Pamela Spearman. I'm a psychologist, and I have some. You're a lot less defensive than I think you could have been. I mean, this is a congratulations. You're doing a good job. I have some comments. I'm a cisgendered straight psychologist, and my other professional organization is the Association for Women in Psychology. And sorry, I'm a psychologist. You know. Yeah. Huh?
Yeah, and also we asked for the mic to be reserved for people who are trans right now. So could you please?
Could I say though?
No, actually. Can you please put the mic down and open the floor to trans folks? Thank you.
My name is Lee Brookins, Boulder, Colorado. They, them, theirs. I really am having a hard time as a professional in this field, and I've reached out to my colleagues, and I just feel like there's so much apologetics happening toward the board. Like, you guys are doing good enough, don't worry. Like, that was pretty good. It wasn't as defensive as I thought, and I just feel like so overwhelmed lately, and it's not, I'm not sharing because I'm here, because I'm comfortable to share. I'm so uncomfortable to talk to you all. And even though I see that there's 5 out of 8 is trans-identified, like, you all are holding a line that is still cis-centric. And it's really painful, and I don't know what to do about people who are publishing articles about rapid onset gender dysphoria and how I am, as a trans provider, supposed to respond to the parents of transgender teens who are pushing, what about this, Lee, and what about that? And I feel like I'm crumbling, and I need more support as a professional, and I'd like to see more support for trans providers, and I'd like that to be more visible.
Zippity do that. I hear you. We hear you. Some of us are in the same boat. I was discriminated against by the last university I was at. I have 2 open EEOC complaints about discrimination. We read the listserv about the people who've been disciplined by licensing boards because they were, quote, biased, okay, and believed children about their identity, okay? Some of us are being assaulted. Some of us in the room are being verbally assaulted by our stand regarding protecting trans children. So we're with you. Your pain is our pain. Okay? And we are going to do better. We're going to be talking on the board about how to provide support to trans-identified professionals and cisgendered professionals who do the work when they're unjustly criticized for doing the work that needs to be done.
Maybe you want to take a crack? I just want to make one comment. Thank you. I mean, thank you for sharing, and I want to recognize. I hear that you said that it was difficult for you to come up and speak, and I really appreciate that you spoke. And we are working on policy level to deal with things like ROGD. And we have some things that are going on right now that we're working on that are not ready for prime time, so we can't really, some of this is like political machinations, and we, you know, there's, but like involving like government issues, and so, but we're on it, you know. There's nobody on this board who puts any credence in ROGD. I mean, it's fake news, and so. Why is the person publishing this stuff a member of WPATH? So that's a great question, and we do not have, as a national affiliate, we do not have any control over the membership criteria. That's an issue of that's being discussed actually with regards to what does academic freedom look like within WPATH. If you were at the ethics pre-conference, this conversation began. There's going to be a section on ethics in the upcoming standards of care. And these issues are being explored. I'm with you. I have the same question. And the question is, how do you come up with professionals, how do you come up with professional guidelines that don't flirt with restricting academic freedom, but that still keep fake news and fake junk science out of the mix? So it's a great question. As far as like the specific, like why is this person a member, that's more of like a WPATH question that we probably can't answer because we don't have control over that. But it's, yeah.
My name is Seth Pardo. I'm with the San Francisco Department of Public Health. My questions are my own, not a representation of my department. And this is very hard to do. There are other professional and academic organizations that do have lower cost fees, which can be subsidized by having larger membership and outreach and engagement. And there are ways to get feedback from membership about how to solve some of the problems that you're struggling with. There have been other organizations that have struggled with similar things, where the membership may have been at a different place than the leadership. And I encourage the leadership, first, thank you for giving it a shot and for fielding a lot of these questions. I'm certain it's not easy, but that the responsibility is yours to figure out for the time that you're in office what to do with it. And I encourage you to really, really work hard at taking this seriously and not just say it. Talk with other professional organization leadership and ask them what they do when they get into these circumstances, and consider having chapters within chapters where membership can have more voice, where those voices can make its way up to the board of directors, so that the board of directors is not alone in the solution making or the decision making, but that the membership can participate in it. And the last thing that I want to say about that is about voting. That when we say that the members who vote decide what happens in the organization, already skips over a huge issue that has to do with how much it costs to be a voting member, and that a lot of the folks that are cohorting into professional status and content matter experts in their field is a consequence and response to the delay in we as trans people feeling comfortable being out and being out professionals. And I'd like to hear more of the voices from the youth. I'd like to hear more voices from transitional age youth and young adults and young professionals and early career professionals and mid-career professionals and experts in their field to participate in our solution making for what we do as an organization. And if we have to tier membership structure but keep the voting authority equal, then that's what we have to do in order for our board to reflect the membership, in order for our leadership beyond the board to exist and to reflect more of the membership, and then to build our membership. Because a lot of people don't want to be members of the organization, both because they don't see themselves reflected in the leadership and they don't see their values reflected in the work. And I'd like for that to change, because I love this organization and I want to continue to love this organization. Thank you.
Well said.
Yeah, I'm Asa Radix. I'm on the board of USPATH and actually also on the board of WPATH. And I think, the USPATH board has been a board for about a year. We've been working a lot on putting together policies and all those legal things. And I think that, I have to say there is a level of frustration that we are a board that doesn't have complete power, because people don't pay dues to us. People are paying dues to WPATH. WPATH sets sets the criteria for being a member, sets the amount of money. But I can say that as the USPATH, I guess we're like a chapter, we can certainly fight for or advocate for the changes that you're suggesting. And that's not to say it would happen, because we know we are kind of below WPATH, right? We're a chapter. We don't hold the reins of money. We don't have an account of our own. People don't pay money to us. But, the change has to be made, and I'm so grateful that people are saying these things, because it also gives us, something to go to WPATH with and say, this is what the US membership is asking for. So, keep up with the comments and questions and advocate for change. Oh, and the other thing is, we've been aboard for a year. We're always looking for members, right? So I just want to say one short thing. I never thought that I would be a member of WPATH. I never thought that I would be a board member of WPATH. Because when I looked around the room, I didn't see anyone who looked like me, right? It's very hard to be on the board when you're like the only person of color on the board. I'm just going to say that. But there's nothing, I don't know if that's a celebration or what, but I think that, what I have said to people again and again is, don't be afraid to step up. If you're not on the board, you can't make change. I finally got tired of sitting and saying this needs to happen and that needs to happen. Well, if you're not sitting around the table, you can't make that change. So for everyone who's been afraid of putting their name forward, look, if you want to put your name forward and you're worried about your application, you can contact me if you're worried, and just like, hey, can you look over this? I'm happy to mentor or help anybody. I think everyone on the board is happy to mentor folks, okay? Maybe that's something we should do, a formal mentorship, but apply to be on the board. That's all I'm going to say.
I just want to put a formal dollar number on it. It costs $210 a year to be a full voting member of WPATH, just to name the cost.
Hi. I think I know almost all of you on the board, if not all of you, and you all know me. But for the people who don't, my name is Laura Jacobs. I'm a psychotherapist in private practice in New York. I'm also chair of the board of the Cal Nord Community Health Center in New York City, which is one of the largest providers to trans populations anywhere. And I identify as trans and genderqueer. So I guess I was building off of something you were saying before. I guess I've found this conference to be much more affirming than I have previous PATH-type conferences. And I, too, was sort of a little wondering who was going to be here and whether the people you mentioned, or referred to at least, Zucker and Lisa Littman and whatnot, were going to be here. And I've spoken out against them many times. And yet, I remember how much of a, I don't know what word to use, the last USPATH was around certain people's speaking and attendance and whatever. And this conference has been a lot more affirming, for sure. But I guess I wonder also, aside from the membership question, which I realize there are limits on what USPATH can do about WPATH membership, but given that USPATH seems to be, as somebody was saying earlier, moving the needle in the right direction around trans inclusion, around things like that, I'm still terrified that at the next WPATH conference, there's going to be a huge amount of transphobic nonsense that happens. And so I'm wondering how we can, as USPATH, push WPATH forward in terms of being more affirming at their conferences and at other events. I realize you've been aboard for a year and this is sort of a very nascent thing, but I'm wondering how we can do that creatively in the future.
Thank you. We're actually very interested in doing that, and very interested in all the issues that you're bringing up here publicly. And what might that look like? What? How pushing back? So so we're airing everything here in the family because there are WPATH board members here, and they've to date at least been supportive of me. We'll see going forward. But I have some objections to how we were set up in USPATH. We have our own bylaws, but we're subject to the oversight of WPATH. As was pointed out several times, we have no funds of our own. I'm going to become the president, and I'm going to agitate for having our own budget, specifically, for seeing the dollars. As my fellow board members know, I requested to see in our board agenda the membership numbers every month. One of the things I'm going to point out, which is the obvious to those who have been paying attention, the percentage of WPATH members that are USPATH people is increasing. That the significant growth of WPATH is in the United States. And so as we are bringing that to everyone's attention, we're going to also have some asks. Such as? Budget and control over our own budget and some authority to make the kinds of decisions that we need to make for our work here in the United States.
Okay, so thank you, and I think that's all great. However, I'm not sure that addresses part of my question, which is how do we push back on WPATH and make WPATH more autonomy? You're talking about giving us more autonomy.
Mm-hmm.
You know, how do the chapters report back to the global organization and push them?
So we have, USPATH has a seated member of the WPATH board. And we're going to continue to have that, I assume. And as time goes by, obviously, we're going to communicate very clearly to the WPATH board. Actually, it's happening right now. We do plan to push back on a lot of things. And to some extent, they are encouraging us, inviting us to do that. I think it's going to be a very uncomfortable process, I'll just predict. And we're going to have some very uncomfortable conversations.
I think that's a good thing.
About money, about membership, about the issues, all the issues that are brought up here.
I guess also policy issues, I would hope.
And policy issues.
Like some of the people we were talking about. And not just individual people, but
yeah.
You know, having people in the organizations who are really affirming, not trying to tear down the trans.
Yeah. Yeah, thank you.
Thank you.
Hello.
I just want to make one other comment to kind of put into context. Did you?
Yes.
Go ahead.
So I have several concerns. And you brought up one that was very important to me as well, which was how do you push back, right? How does an organization, let's just say like USPATH, right? So I don't know how the whole makeup of WPATH goes with voting, right? But I'm sure that the majority of the members are from the United States. Is that true? Okay, so I just wanted to know that. So the majority of the members are from the United States. So USPATH should have a strong voice and a strong hold in how policies are created moving forward and standards of care are moving forward with WPATH. Don't you all agree?
Do you want to ask? Do you want me to try to respond to that, or do you want to ask the rest of the things?
Yeah, no, you can.
Should I respond to?
You can respond to that first. Yeah.
Okay.
Then I can.
So, WPATH, the W means world. And, so it's a complicated situation because if we push, and I don't know that this would be successful, but let's say we were successful in pushing for WPATH things to be more US-centric based on percentage of... Well, yes, but also there was this question about how do we make like the standards more like U.S. So there's a question: more affirming, more U.S. centric, any of the above. You know, we're up in WPATH. You're up against some pretty powerful forces of other countries, and you have to walk this line of like you don't want to. You know, the U.S. is a colonial empire, and you don't want to have this. There's this thing of like the U.S. is colonizing WPATH. And then that kind of defangs WPATH, because in WPATH, you know, because like, so I've gone to Peru and met with the vice president and the minister of health as part of a project, and we brought some WPATH materials with us to try to convince the government to be more inclusive with trans health. and they're pushing back against some things, and then they're also voting membership of WPATH, and people can wind up on the boards from some conservative European countries, so that's kind of like that's the bigger picture. I'm not making any excuses. I'm not even answering a question. I'm just kind of observing that that's kind of the milieu in which we're dealing with it. So we do have a couple of things that we're working on with WPATH already. So we're already working with the GEI initiative to provide some additional feedback and guidance with regards to in the least GEI activities that occur within the USPATH jurisdiction, which would be the US. So that is something that's actually a process that's already in progress. We're in conversation with WPATH. The WPATH GEI leadership has been receptive so far to the feedback and the different kind of ideas that we're beginning to have about how to, so that's a concrete example of an active project that we have to try to improve certain aspects of some WPATH activities. But the concerns are heard.
Okay, so the next portion of that, my concerns around this are around social determinants of health, right? What is USPATH? Okay, so we talk about poverty, homelessness, you have minority stress, you have incarceration, you have healthcare. All of these things, right? All of these are different potential tracks or ways to bring other people in to have a larger conversation, right? Because these are overarching concerns, right, with these social determinants of health, right? So why does the conference have to just be focused, give a provider focus, right? What would it look like to kind of switch that up and apply other tracks and maybe come at it from the perspective of social determinants of health? The other part of that is also, when it comes to communities of color, and particularly I can speak as a Black trans woman, and amongst those that I know, when it goes to going to therapy and psychology, that is a problem, right? Because it's not a part of our culture. So getting those letters, entertaining those affirming letters is difficult, not because people may not have the access, but because it's not something in their culture. It's not something that we choose to do. So what are ways we can work with that and go back to the social determinants of health?
Thank you. We do have, actually, I don't know that the percentages are, but a substantial percentage, I don't have the specific data, but we have within our tracks, there's an epidemiology track, a policy, and there is a social sciences kind of humanities track. So the conference is not just like how many milligrams do you give or like how do you like counsel a patient. We do have those other tracks, the epidemiology and social sciences. I mean, certainly hear that there would be a desire for more visibility. As far as the other part of the question was, the letters.
Yes.
Yeah. So I mean, that's a much bigger question. Standards of care, like clinical practice approaches. I mean, this is also something that we talked about a bit during some of the pre-conference. That I talked in the in the surgery preparation piece. The advocacy is really moving towards having these kinds of mental health assessments really integrated into programs so that you don't have to like go out and find a therapist and but that you just go to if you're going to have a kidney transplant, you go to a clinic and you meet with a social worker and you meet with a general doctor and you meet with a therapist maybe and so this is one model that is being advocated for where you don't have to go like out and shop around. And then the other thing for people who are not working in these integrated programs but do need these kind of bits and pieces to put it together, then we continue to advocate for access and providing training through initiatives like the GEI to increase the number of kind of skilled providers. And yeah, you don't need to go see a therapist for 6 months to get breast augmentation. Maybe you just need to meet with somebody once who is going to kind of talk you through it, make sure you kind of understand and prepared and have a place to live and everything. I mean, we can kind of talk offline about all of the like medical reasons to do these kinds of initial screens.
But again, my question was about the social determinants of health. and particularly when it comes to communities of color. What can USPATH, or what does USPATH see going to the future of ways to address those social determinants of health, not just during the conference, right?
Okay, I misunderstood. Yes, so you're like, what are we doing to actually budge the social determinants of health that interact with the health of transgender people, period?
Yes.
It's kind of a big
question. So, let's see. Several of the people on the board have a background in public health and population studies, and we are tuned into this as an important issue. Like with some of the other issues, it involves standards of care, but it also involves a recognition that we're coming into this with the problems already present: homelessness, health disparities, huge health disparities, health risks, and we are interested in all those things. We assume our scientists and our practitioners are devoting themselves to those issues, and we expect them to continue.
Thank you. My name is Catherine Croft. I am a trans woman and a nurse by profession, but I've recently come in to be the manager of our new transgender health program at UNC in Chapel Hill, North Carolina. And so when I took this position as a member of the trans community, I had two immediate concerns as both a hiring manager and someone who was able to influence trans health in my direct community. The first was, how do I get trans voices represented in our decision-making process? When I would talk to other members of my local community, that was a big complaint, is that physicians were primarily cis, especially in our area, and weren't necessarily considering the trans point of view. So it's like, how do we elevate those voices appropriately? And then further, the second thing that I was thinking about is just broader, how do I personally and as a professional elevate more trans people into the kind of positions that I'm in, into more healthcare positions, decision-making positions. And so when I come here, I've been so happy to see so many trans providers, and that's been really fantastic. But when I go back home, when I go back to North Carolina, or I go back to the South, the thing that I run into is that not everyone has my kind of opportunities to step into these kind of roles and make decisions for trans health. So I really see this professional organization as a fantastic tool to help grant guidance to us in our both cis and trans professionals, hiring managers, healthcare advocates, who create and further trans health. Like how I see USPATH as having a really integral ability potentially to put forward statements and say, this is why you should advance trans people into these management positions, into these hiring positions, into getting a voice on the table. I hear a lot of what you're saying about USPATH and its relation to WPATH and your percentage of the board, and I think that all of that is really fantastic. But I do think that when I go home and when I go back to North Carolina, when I look around, I'm the only trans provider in the room. And that's something that I'm sure some of my colleagues here have experienced. And so we as members of the trans community want a seat at that table. We want to be able to make decisions for our own healthcare. And I would just like to kind of put it forward, what can USPATH do to help advance trans providers and also help include the voices of the trans community in what we do? Because when I step up as a trans provider, I have to represent in some ways my community, especially to my cis colleagues. So, I'm very worried about making a bad impression as a trans woman, because then suddenly all of us are bad to some people, especially in the South. And so, I look for ways to include the voices of our community. So my two concerns and things that I think USPATH could potentially really help us with, especially from the guidance perspective, is how do we as all professionals, both cis and trans alike, integrate trans professionals into our structure and also really integrate the voices of the trans community into what we do every day. Thank you.
I still have this short straw. So institutional racism we started out with, institutional sexism, misogyny, let's go there, transphobia. We're concerned about it. You know, we want to push back against it. We want to make a dent. We want to move the needle a long way, not just a little way. And you know, you've given us some food for thought in terms of, you know, what can we do to be a resource? The listserv, for example, you could recruit people from all over the country to come to North Carolina who might think, okay, great, HB2, I'm going to kick some ass down in North Carolina, okay? Yeah, great. Let's keep talking about how we can be a resource.
I have a quick question I'm going to ask real quick. And I'm going to ask Tony Michelle, can you step up to the front, please? Yeah. So yes, as you know, like I said, I'm a community reporter. I work for Transforming. This is my very first time at USPATH, but I think it's really important to say this. So this is Tony Michelle Williams. No, seriously, this is Tony Michelle Williams. And I feel like it's full circle that she's here because when I met Tony Michelle, we were coworkers. She was running a study called The Most Dangerous Thing Out Here is the Police. She was doing research as a black trans woman in Atlanta, Georgia, okay? No, and she also just got her degree, so also clap it up for Miss Tony Michelle Williams. But she concluded that study before she even completed her degree, right? So I say that to say, and also was part of shutting down the Atlanta City Jail, and is now appointed to, and is turning it into a wellness center. Okay, so I say all that to say, I think it's a major problem when people like Tony Michelle Williams can only come here for a town hall. You know, that's why I said, the financial inaccessibility of this conference is really a big issue, even for me. And I feel like even though I'm a community reporter, honestly, most people who are black and trans do not have access to get bachelor's degrees, master's degrees, or what have you. We can't keep picking the exceptional, whatever standards of exceptional that, are defined by white clinician standards, right? Because I wasn't even the only person in my organization that applied to be a reporter. I was the only one chosen. I'm the only one with an Ivy League, degree. But the two people that were passed over know way more than me, And the folks in grassroots organizations know more than anybody in here, to be honest. No more than Ms. Dee Dee Waters too. So, and I thank you for bringing your question. So I'm saying it's very critical that we get rid of those costs. And there's a solution. I really don't believe that there's not. That's not an excuse we could continue to give. And I'm saying that as a reporter, and I'm not trying to turn on anyone, but I'm just we have to say the truth. We have to say the truth. If we really want our communities to take steps forward, we have to say the truth. And people like Tony Michelle need to be here because we lose so much, and Ms. Dee Dee Waters need to be here because we lose so much when they're not here. So whatever needs to be done, whatever we could do to make it free, because for these two women, it should be free. For my boss, PT, it should be free. For Ms. Dee Dee Shambly, who's the executive director of Legender and who's been doing HIV work for years, it should be free. Yes, and Jasmine Tasaki as well, it really should be free. Because they could teach all of us something. They've been teaching me my entire, career, so seriously. Well, yeah, go ahead. If you have a question, please answer it. The legendary Tony Michelle.
Yes, give it up for Dorcas. Yes, in London. What we see here is black, trans, and queer leadership. Yes, give it up for black and trans and queer leadership. Which was one of the reasons why I had a question. I first wanted, you pulled me up, but come up here, my sister. Yes, Miss Dee Dee. I think it's okay to say that in 2019, close to 2020, black folks, we will interrupt. We will interrupt. Black trans folks will interrupt to share our truths. This is not an interruption. It's just a sharing. So she has something to share.
So just real quickly, two things. One, I would like to suggest, I don't know if you all already have like committees, but I definitely would love to suggest like community committees so that the way that the members, the people that you all are inviting here can actually be able to be a part of certain things. If we want to call y'all, I call us out too. Just invite us to the table, pretty much is what I'm saying. But I really want to say something towards like the way that the responses came. One of the responses was that it was 5 to 8. Do you know how to count? That was very insulting. It really triggered me. And I really want to let you know that there's no pun intended. I really think that you may be a great person. I hope that you stay the president. I hope that this goes in the right direction. But that was very like horrible. The other part is that whenever you stand up and to say so many times about I've been discriminated against, I get it and I hear it and I know it because I live it, and for you to say it to me is insulting because as you look at the 18 names that are on that list that have been murdered, it is 17 of them that are black trans women and one white trans man who was murdered by his brother. Okay, so this is... I want to say this, and I really hope that many of you all understand where it is that I'm coming from with this. While I was here, I don't know, and I may be dead wrong, but while I was here, I didn't see anyone that was here to interpret for people that may have spoken another language. That should be a door and an opportunity that should be there. There should be a question to it. The other part is that when we eat, if we are protected, we're the bottom of the totem pole. So if we protect, there's protection for so many others. When you really look at the way that black trans people are treated, the way that we have to go through so many different things, whenever there's no rights for us, that means that there's really no rights for you. So therefore, at the end of the day, the only reason why I wanted to stand up here and say what it was that I was saying is because I genuinely believe that you all are trying to go in the right direction, right? But at the end of the day, if you're going in the right direction, sometimes it's just okay to sit there and not have a response to everything. When you all are giving these responses, right. And so it's like, and it's like, it's cool because it's cool, but it's like at the same token, I've been here and I've seen many of you all, and for many of you all to be in leadership and to have certain people around, like I should know who you all are. You know, no offense, but it's like at the end of the day, whenever you see people that's in a space that haven't been here, it's like it's super important for folks to know who y'all are. You know, and that's just what I want to say. I felt like it was very triggering, and I wanted to say something really horrible, but I didn't, and I just wanted to make sure that I let you know that like it was really triggering. So please just kind of watch that, and that's cool. Thank you. And thank you for giving me this space. Thank you.
Stay right here, baby. Thank you. It's really important that y'all give love, but what we need to start practicing, because y'all are a little bit behind, I can make that assessment. My people in Atlanta, yes. I can make that assessment because there's not enough black and brown folks in this space. So y'all are just a little bit behind. So to catch you up, I know y'all gave her love, but is there an apology that you are willing to extend and offer, or an acknowledgement of the trauma that she just experienced?
Yes, and I'm... It's on. So, hard to know who to look to. So I'm sorry you were triggered by that. My confusion...
That's not an apology.
Something that no one in the world does, and that's practice grace with each other. So I'm going to extend a little grace this time, and we're just going to model what this could and should be looking like. But after that, we shouldn't be doing this anymore, Executive Director, okay? Right here, is there something you want to hear from this person to help you feel restored and more alive?
To be honest with you, just to stand up and say, you know, I apologize would have been more than enough, and then to just sit down.
Let's do that.
I apologize.
Wait. Hey. That's not what we're practicing. Come on, let me help you model. So I want you to actually stand and face this person. Not too close, but just enough space so we feel that you're real. You know what I mean? Okay, give me this and put your hands by your side.
Honey, you weren't here when we had this interaction before. I don't think,
I
right?
got you, I promise. It's okay.
So
I got
it's not okay because I don't want it.
Oh, you don't? Bam.
Hi, everybody. Well, I'm going to make it quick. I don't want you all to feel attacked. This isn't an attack. This is a call in, not a call out. My name is Jasmine Tasaki. I'm the executive director of We Care Tennessee in Memphis, Tennessee, the first trans-led organization founded by a black trans person. And I am honored to be here. I can tell that this is an extremely great conference for who is here. My concern is, how can I be a person that has worked in this field for so long with several organizations, and I had to hear about it by word of mouth through another black trans woman, and coming here I expected to feel affirmed in the space, but it felt a little shocking because there aren't many people of color here. So my suggestion would be exactly what they said before, developing relationships with community-based organizations that are ran by trans people, but also your board of directors should reflect trans people of color and trans people of color who are living with HIV. Because if you really want to help end the epidemic, you're talking about dealing and engaging with people of color who live with HIV, right? So they're the only ones that can make the best decision. Not to say they may not have the academia you have, but they're the ones that can give you the yes and the no to if it's effective. Just like right now, a lot of y'all are uncomfortable, but black women living with HIV are uncomfortable every day of their lives. So the 5 minutes that you're uncomfortable now, just know it took a lot for us to come up here, but it also took a lot for us to get in an Uber and pay to get here when we're here for someone else and we're paid to do something else, but we can't stand with our sister. So the power that we have united, it extends to you all as well. It does not, power transcends race, power transcends gender, as does healthcare, or as it should, I'm sorry. And if we want that to happen, then we have to be inclusive of our people. So just want to say again, I apologize on the behalf of whoever has offended someone. When you apologize, it's not, I'm sorry if you were offended, but I'm sorry, my intention was not for you to be offended, but for you to feel welcomed. And from here on out, your experience will be there because I'm going to practice using behaviors, using communication that is open and receptive. So a lot of y'all out there get it. So we just got to tap the one on the shoulder next to us that don't get it, keep it telling them and keep it coming. But I love y'all. I hope y'all love us after this. And thank you for having us.
I just want to share that. What's your name? This person here. Miss Erica. Yes, Miss Erica and I had a lovely conversation where I kind of just described what the impact was. Everybody in this room, I'm sure, can share with Miss Erica what you felt the impact was. The only way that we will transform and grow and continue to save the lives of black trans women who are being murdered every day to this week is if we push back to transform, if we speak up, not just speaking up, saying nothing and responding and saying nothing, but allowing folks who are impacted, black folks, brown folks, trans folks, to say the truth, and everybody needs to stand the fuck up and share their own truths too, and not let us say our truths alone while y'all sit and not say anything in return. Everyone, Puerto Rico, places all over this world are retaliating and fighting the fuck back. Everybody say, fight the fuck back. That's exactly what needs to happen. And the next time we come up in here, I need to see my girls up on these 2 rows in this leadership, because we don't trust that anything will get done. We don't trust that anything will get done if we're not here with you, making decisions, having these conversations with you. Ashe.
Look at my mouth. First of all, I just want to thank y'all for your emotional labor. Yes. Before I do anything else. And I feel that was so well received. I felt it. Oh, I felt it so deep. I know I felt it. So I know everybody in here felt it.
But yeah, thank y'all. And I'm sorry you had to do that even during this week, because it's been a rough week. What's up?
Okay, this is really, really hard to talk about, but there's a lot of people in this room who are in between where this board is and where you are. A lot of people who are in between those two places. So for us, when we hear somebody on the board say, we were discriminated against, it's just as disturbing for us as it is for you. Not as much as it is because you're the ones who are, you're the people of color, right? But
I'm sorry, really.
I
Okay.
just want to say,
But constructively, I have to say, I think there's a level of violence in terms of comparing your experience as a white person to black people.
And there's also, I'm trying to understand what you mean by what it.
Same.
I also want clarification when you said between the board and where you are, because where are they and where is the board? I just wanted clarification on that.
The board is saying that they understand that they've been discriminated against too. And a lot of us in this room, there's all different levels. And so there's
have a white conversation.
no,
Thank you, Ace.
no.
Yeah, because I think.
Please give me a moment to share with you. Please give me a moment.
I'm not sure. Are you? Well, actually, I should have asked. This. Are you a member of the trans community?
I am a non-binary trans person who is a social worker.
Okay.
I have a PhD in 2 fields, and I cannot get a job as an academic because of the prejudice in this country.
So you have a PhD
in 2 fields, and I'm working as
huge dick.
I'm working as a social worker at a hospital because why?
Okay.
Because
okay. Well, at this point, we would like to wrap that up. Another thing I would like to bring up to the audience is that WPATH and USPATH, moving forward towards January, will be taking open comment period. And if you all have registered, we just wanted to get your permission to send emails and further notifications so that when open comments come, that you're able to put your comments in about standards of care. So again, we just wanted to get your permission, seems like everyone's clapping, to send out notifications, okay?
Thank you. Thank you. Thank you. Thank you, everybody, for participating. There were some difficult conversations here that need to be had. And I think that probably less is more for me to say right now. And I think that one takeaway that I'm going to bring back to the next, bring up at the next board meeting, and I think my colleagues probably agree, is that a discussion around power, privilege, and unconscious bias is something that needs to be centered in this sphere. Thank you.